medical education.
I'm Dr. Carrie Cwiak. I'm a full professor in Gynecology and Obstetrics, Division of Family Planning, in the Department of Gynecology and Obstetrics, School of Medicine at Emory University.
I'm Meg Lawley. I'm an assistant professor in the Division of Family Planning for the Department of Obstetrics and Gynecology for the Emory University School of Medicine. What do you feel are the most significant challenges for women today from a family planning perspective?
I think one of the biggest areas is in shared decision making. And so really making sure that we are interacting in a discussion, in counseling with our patients, so that it's not just us providing recommendations without listening to the patient.
I agree with that. I think a big part of this, when you talk to women and you're sort of exploring the reproductive plans, is, like you said, taking a step back and sort of examining the whole picture. When are you planning a pregnancy? What are our goals in the next couple of years? Does that include pregnancy? Does that include not getting pregnant? Let's talk about sort of the big picture. And I think sometimes that gets lost, and that's one of my favorite parts of our job, is that you get to address the whole picture.
I'm incredibly proud of the fact that we have a group of highly educated women in a field that probably is a little unknown to other people. So the fact that we are all trained in obstetrics and gynecology, but then completed a fellowship in family planning and completed a master's in public health provides us the unique experience and expertise to be able to guide women in these decisions.
Carrie, do you feel that there's something special and unique that you bring to women's medicine as being a female physician practicing today?
When we bring a diverse population of providers, then we are more able to meet and address the needs of our diverse population.
You know, one of the things that I love about the patient population that I work with is that it's easy to relate to them in some respects. You know, I walk into a room and I walk in not just as a physician, but as a mom, as a sister, as a partner, as an educator, and I know that a lot of my patients are the same way. So all of the things that they have to think about when we're trying to figure out, you know, whatever their specific health needs are, that, you know, I'm taking all those things in and thinking about them being a wife or a partner or a mother, and how I would want someone to approach me in the same way.
I think about some of the work that we're doing specifically in research, looking at new methods of contraception, and how it's important to continue to look for methods that do meet the needs of our patient population. That is the other great thing about having so many methods to choose from, is that then someone doesn't have to be boxed into one particular thing, and it allows them to really choose what works for them.
I agree. I always kind of have a tagline when I'm sitting down with someone for the first time. It doesn't matter if they're 14 or 44, that I'm like, the great thing about being a woman in 2018, and then you like turn to the side and you're like, these are, the world is your contraceptive oyster, hooray! And
Here we go.
I usually get a laugh, maybe a look, I know, sort of. But I agree, I mean, you know, it's kind of like, it's like anything. Sometimes it takes a couple tries to figure out what's the best for you, but you know, the great news is we've got a lot of things to try, so let's get started.